Hi, Michael.
Hello.
Thanks for coming in today for your feedback session. I'm going to go ahead and give you a copy for you to look over, and I'll take a minute and explain a little bit of what this is. This is a confidential feedback form specifically for you. You can see that your name is on it. And Michael, when you first came into treatment, you might remember that you answered a lot of questionnaires for us. And this is that information, those answers that you gave us back to you in this feedback form. So similar to like how you would go to the doctors and get results of blood work. If you can want to think about it in that way, this is the information that you gave us that now we're going to give back to you in the form of feedback.
Okay.
Okay, I'm going to tell you a couple more things. If this is completely confidential, these are the answers that you gave us. So I really want this session, Michael, to be interactive. If something doesn't look right or you're not sure about something, I encourage you to speak up, ask any questions, and bring up any comments that you have.
All right.
Okay, sound good?
Sounds good.
All right, we're going to get started then with the first section, which is healthy behaviors. So I'm going to read through some of the healthy behaviors you've done since you've been here in treatment. You've completed detox. You completed the housing plan. You are participating in Cornerstone treatment. Michael, you also agreed to sample abstinence. And on this side are some things even more specific to what you're doing. You're living in a recovery housing.
Yep.
You're attending NA meetings every day?
Every day.
That's great. You're also taking care of your health. It was something that was very important to you.
Yeah.
And you're going to DSS.
That's correct.
And that's another behavior that was really important for you to go and get that taken care of. So, Michael, I think this is a good summary of some of the things that you've already done so far since being in treatment. Are there any others that you can think of?
Not really. With taking care of my health, I've been starting to exercise now, so that's another thing I'm doing.
Good. So exercise is something that's important to you.
Yeah.
Taking care of your health. Well, good. I'm glad that you've already started doing that, and I encourage you to keep that up and to continue.
Thanks.
This next section that we're going to go through is a description of your drug use. The age you first used heroin was age 22. The age you first used cocaine was age 25. And the age you first used alcohol was age 22. Your audit score was a 4.
And what does that mean?
The audit is one of the questionnaires, assessments that you answered when you came in relating to your alcohol use. So you rated a 4, which is a middle to a moderate score.
Okay.
Indicating that alcohol has been a little bit of a problem for you in the past, but not too much. Would you agree with that?
Yeah, I think more in the past. I don't really drink that much nowadays, but...
So alcohol's not a problem for you now?
No.
The number of months that you've used heroin regularly has been 176.
Yeah, it looks right.
A long time?
Yeah, it is a long time.
Longer than you thought?
I think it just looks like a big number. 176. It's probably right.
Yeah, when you add all the months together.
Yeah, that makes sense then.
The number of months you've used cocaine regularly has been 12.
Yeah.
So a lot less than the heroin use.
Mm-hmm.
The cocaine use has just been a problem for you more recently.
Yeah, I've only been using it for maybe the past year or so. Never really did it before that.
Okay. This next part, Michael talks about some statistics of how you fit in with other Americans in your age group. So 0.1% of Americans in your age group have used heroin in the past year. That doesn't sound right to you.
It almost seems like there'd be more people.
That number seems low.
Yeah. That's really low. 0.1%. That's not even 1%.
Yeah, so it's less than 1% of Americans in your age group who have used heroin in the past year.
Wow.
And it's 1.4% of Americans in your age group who have used cocaine in the past year. So it's more, it's a little over 1% of people that have used cocaine.
Mm.
You still look a little confused.
It just seems small numbers, but you know, I guess that's what it could be.
Well, Michael, when you think about, and actually where I can tell you where this comes from, the National Institute on Drug Abuse does a survey of Americans, and they survey people throughout the United States. So in other states where drug abuse may be less common, maybe like North Dakota or Iowa or some of those other states. So when they sample all of those people, it actually comes out to these numbers of people who use drugs.
Okay, that makes a little more sense now.
It's sometimes a different way to think about it, because here in Baltimore, it seems like everyone around you uses.
Absolutely.
Is that how you feel?
Yeah. Yeah, I see it all the time, everywhere.
Yeah, so when we think about it kind of in the broader perspective of across the United States, it's really a very few number of people who use drugs.
Okay.
The amount of money spent on drugs in the 30 days before you came to treatment was $2,500.
Yeah, she went to.
Yeah.
Yeah.
And the amount of money spent on drugs in your entire lifetime is $200,000.
Wow.
It's a lot of money.
Yeah, that's a lot of money. That is a lot of money.
You've never really thought about it, kind of adding up all those months of drug use and what it's come out to.
No, not like a number like that. Wow.
What are you feeling right now? What are you thinking?
I say I spent a lot of money on drugs. Probably could have done some other stuff with that money.
Well, this is just a good thing, you know, just to keep in mind and helping you kind of move forward and thinking about where you know, that money you did use, where you can put it to now.
Yeah.
And we're ready to move on to the next section.
Yeah.
You know, risk factors. Okay. And these are some of the risk factors you may or may not have, Michael. Living with another drug user. No, that's not a risk factor for you currently.
No.
And part of that is that great decision that you made to move into the recovery house, which was mentioned back at your healthy behaviors. And you've been living there for 2 weeks now.
Yeah.
Which is really great.
Thanks.
I commend you on that decision to move and into that recovery house. And I think it's helping in your recovery so far.
I think it's really helping me right now.
Good, good. I'm glad to hear that. So that's not currently a risk factor for you. Friends or associates who are drug users. Yes, that's a risk factor.
Yeah.
You still
That's a
know
big
people.
one. Yeah.
That's a big one for you.
Mm-hmm.
Having friends or knowing people that use.
Yeah.
That can be difficult.
Yeah, it can. You know, all my friends use drugs or deal drugs, so it's not easy.
And I know we've talked about already since you've been here ways that you can try and minimize your contact with those people.
Yeah, I'm going to have to.
Yeah, I think you've already started doing that. And one way I know that is by moving into the recovery house, you left the environment where there was drug activity going on.
Yep.
So you've already started to make some of those changes.
Yep.
I encourage you to think of other ways that you can continue to minimize this risk. So other ways that you can increase positive people in your life.
Yeah, I think going to, it's only been a couple weeks, but going to those NA meetings, and the people at the house are pretty cool, and they're nice to hang out with and they're not using, so that's a start right there.
So you're enjoying the NA meetings?
Yeah, I mean, they're all right.
Getting used to them?
Yeah, it's different, so we'll see.
It takes an adjustment sometimes.
Yeah.
I'm glad that you're, you're at least going, and I encourage you to just stick with it.
I will.
Good. Living in an area with easy access to drugs. That's another risk factor.
Yeah.
It's hard to get away from that in the city.
Yeah, it is. Yeah, it's, even just going to some of those NA meetings, you'll see people out there that, you know what they're doing out there.
Yes, you have to be careful of those friends and associates and then being in those areas.
Yeah. But they got this buddy system at the recovery house where we go with another, like a roommate to the meeting, so we sort of help each other out, and that sort of helps out.
Yeah, so you're not alone in some of those areas that you don't want to go by yourself.
No, I do not. Not right now.
Well, that sounds like it's really helpful for you.
Yeah.
Good. IV drug use. No, you don't have a history of IV drug use, so that's not a risk factor for you.
No, I never. Don't like needles.
And Michael, people that do use IV are at a higher risk for relapse, so that's why this is on here as a risk factor.
Okay.
And the last one here is a family history of drug and or alcohol problems. Yes, you do have a family history.
Yeah.
And that's impacted your drug use.
Yeah, I definitely think it did. Parents who used, I pretty much saw it right there, and didn't really have too much consequences from, using and stuff, and just got away with things.
So that's been a challenge to overcome that when you have people in your family that are using, your parents using.
Yeah. Yeah, I mean, it's gonna be tough now that I'm not using, and I haven't even really talked to them in months, so.
And that's hard sometimes to sort of remove yourself from relationship with family members.
Yeah, I mean, who knows? They might even be trying to get clean right now, but I just gotta worry about myself right now, and I'll deal with that. But I do want to deal with it eventually.
I think that's really a smart decision, Michael, and I like how you've increased your family support with NA and with the recovery house. And we can talk about when you're feeling ready to contact your family, the ways that maybe will be best to do that.
Sounds good.
Okay. Okay, Michael, well, this has been your feedback session, and I just want to take a minute and summarize that I think you're off to a really good start in treatment. You have some really good healthy behaviors. You've already started making some of those changes in your life, and I just encourage you to continue with the good work that you're doing.
Thank you.
And what did you think about, I'd like to get some of your feedback on this session. Was it helpful for you?
Yeah, I think so. It's, it's a lot of stuff that I'm doing or have done, but I never really, looked at it in this way. Especially the things like all the money I could have been saving, or just how long I've actually been using heroin. So I think it's good, definitely.
So it was helpful for you to see it down on paper and for us to talk about it.
Yeah.
Good. Okay, well, thanks.
All right. It was on, right?
that is. Low CDs. Get some air in here.
I know.
Yeah.
It does get hot in here.